Assalamualaikum. In this video discussing recall communications that come on 2023 Jeddah, that is the task is that speak to a 20 weeks pregnancy with show cleft lip and cleft palate. So antenatal check up a mom who is pregnant, we need to talk about cleft lip and cleft palate. So as usual IRCAP and explanation of the cleft lip and palate, like in the womb, a baby's face is formed of several parts coming together, like a petals of a flower. Okay, the word cleft means a gap or split. Clefts can be in the upper lip, the roof of the mouth, that is palate, or sometimes both the lip and the palate occur. When the upper areas of the central face do not quite join together properly, leaving a gap in the palate, the upper lip, or both. So our face is in the womb, the development is several parts several times. Development is like a petals of flower, but when there is a cleft means split or gap. When there is the fusion between the central part not occurred, there is a gap remain, that is cleft. If it is on the lip, that is cleft lip, and if it is on up to the palate, then it is cleft palate. So the explanation is like that. The mother asking, is it treatable by a medical professional, doesn't require lab test or imaging, can last several months, present at birth. What are the problems in cleft lip and palate? First of all, speech difficulties, impaired voice, snoring, feeding difficulties. You can express your milk, and we will give to an obturator, that is you can give, that is ear infection causing hearing loss, missing teeth or extra teeth. So these are the problem occur: speech difficulty, feeding difficulty, then there is ear infections. These are. So what are the causes of cleft lip and palate? The exact cause is not known. The causes are a birth defect, genetic and environmental factors, family history play a role. The risk factors of cleft lip and palate are alcohol consumption, cigarette smoking, insufficient consumption of folic acid, and prenatal vitamins. Being obese or having diabetes during pregnancy may also increase the risk. Also, some drugs causing cleft lip and palate. These are phenytoin, isotretinoin, and sodium valproate, benzodiazepine, and steroid. So these are the cause. Some are genetic, some are alcohol consumptions, smoking, cigarette smoking, then insufficient take of folic acid during pregnancy, diabetes mellitus, also some drugs, phenytoin, isotretinoin, sodium valproate, benzodiazepine, steroid. Now diagnosis. Diagnosis of cleft lip and palate can be diagnosed antenatally. After labor, diagnosed clinically. Scan the whole body to screen for other disease and syndromes like Appert's syndrome, Golden Heart syndrome, Dajor syndrome, Chart syndrome, Pierre-Robin syndrome, Edward Patau, and trisomy 15. These are the syndrome associated. We need to search this. Now, what is the treatment of cleft lip and palate? Feeding strategies such as using special type of teeth device we can use. Speech therapy to help speech development, speech and language therapist for speech therapy, orthodontic adjustment to the teeth and bite, such as having braces to straighten the teeth. So brace can be on the teeth. Monitoring by a pediatric dentist, monitor by an ear, nose and throat specialist. Surgical repair, cleft lip remember 3 to 6 months, and cleft palate 6 to 12. Again, the surgical treatment cleft lip is 3 to 6 months, cleft palate is 6 to 12 months. And the team we involve surgery, speech and language therapist, that is SALT, GIT, nutrition, dentist, breastfeeding specialist, ENT, and audiology. Advice we give: if she got pregnant again, to take folic acid. So we'll give the advice she take folic acid when she got pregnant again, must take. So this is all about cleft lip and cleft palate communication. Thank you.